Hello guys, welcome to Dr. Science. So today we are going to talk about the muscles of the thigh and its nerve supply. So this is taken from your anatomy textbook, and in order to understand this, first we have to understand the lumbar plexus. So usually this lumbar plexus is divided into anterior division and posterior division. From this lumbar plexus we are going to derive the nerve supply of your thigh. So this is necessary in order to understand this topic. So from the lumbar plexus usually we have the L1, L2, L3, L4, L5 and your S1, S2, S3. From the anterior division we are going to derive the main nerve, which is your obturator nerve. And your tibial nerve. So the anterior division is going to form mainly two nerves, which are your obturator nerve and your tibial nerve. So the obturator nerve is derived from L2, L3, L4. So as you can see here, the L2, L3 and L4 will fuse together and form your obturator nerve. And similarly the tibial nerve is derived from your L4 to S3. So once again here L4, L5, S1, S2 and S3 will fuse together and form your tibial nerve. So what are the two nerves which are derived from the anterior division of your lumbar plexus? The obturator nerve and the tibial. From the posterior division we are going to derive mainly two nerves, which is your femoral nerve and your common peroneal nerve. So usually the femoral nerve is derived from L2, L3 and L4. As you can see here, the L2, L3 and L4 will fuse together and form your femoral nerve. And the common peroneal nerve is derived from L4 to S2. So as you can see here, the L4, L5, S1, S2 will fuse together and form your common peroneal nerve. Usually the common peroneal nerve is divided into two nerves. One is your superficial branch and the other one is your deep branch. I hope you are clear with this. Next we are going to see what are the muscles of your thigh. So in order to understand this, we are going to draw a small diagram here. So usually this is your thigh. This is the leg and this is your foot. I know this is a very funny diagram, but I hope this will help in order to understand this. So this is the thigh, this is the leg, and finally we have the foot. So the thigh is usually divided into mainly three compartments, but here we are going to draw only two compartments. One is your anterior compartment, the other one is your posterior compartment. Similarly in the leg we have the anterior compartment and the posterior compartment, but since we are going to talk about the thigh, I will talk about the anterior and the posterior compartments of the thigh. So the posterior compartment is usually supplied by a nerve called your tibial nerve. And the anterior compartment of the thigh is usually supplied by your femoral nerve. So the muscles which are present in the anterior compartment are supplied by femoral nerve, and the muscles which are present in your posterior compartment are usually supplied by your tibial nerve. So now we are going to see the coronal section of your thigh. So please draw the diagram here with me. So this is the coronal section of your thigh, and we are going to divide this thigh into anterior compartment and the posterior compartment. This is your, let's draw this clearly. So this is your anterior compartment and this is your posterior compartment. So not only that, we have medial compartment also. So all this is your medial compartment. Okay, first we will talk about the muscles present in the anterior compartment, then we will talk about the muscles present in the posterior compartment. Finally we will talk about the muscles of the medial compartment, which are mainly your adductor muscles of the thigh. Okay, so in the anterior compartment of the thigh, usually we have a donkey here. The name of the donkey is sartorius, and not only that, we have a rectangle shaped muscle called as your quadrangular femoris. So I already told you the muscles of the anterior compartment are usually supplied by which nerve? It is your femoral nerve. Okay, so sartorius and quadrangular femoris are the two muscles which are present in the anterior compartment and supplied by your femoral nerve. Next we are going to talk about the muscles in the posterior compartment, and usually the muscles in the posterior compartment are your hamstrings. And what are your hamstring muscles? One is your semi-membranous muscle, the other one is your semi-tendinous muscle, and finally we have the most important one, the biceps femoris. Usually the biceps femoris is going to have a long head and a short head. Please remember this one, because the long head and the short head usually have different nerve supply. So since these three muscles or the hamstring muscles are present in the posterior compartment, usually these posterior compartment muscles, which are your hamstring muscles such as your semi-membranous, semi-tendinous and the biceps femoris, are supplied by your tibial nerve. Now the most important thing here is, as you can see, the short head, this one is supplied by a completely different nerve, which is called as your common peroneal nerve. So the only exception is that one, that biceps femoris, the long head is supplied by the tibial nerve, whereas the short head is supplied by your common peroneal nerve. Don't worry, I will summarize it in the end. Okay, so finally we are going to talk about the adductor muscles, or the muscles present in the medial compartment. So this one is a little bit tougher compared to the anterior and the posterior compartment. So draw this one a little bit big. In the thigh, we only have the medial compartment. We are not going to have any lateral compartment. So this part I am going to just scrap it off. So in the medial compartment we usually have a very long muscle, and this muscle which is very long, and this muscle is adductor. It helps in adduction of your thigh, hence it is a the name of this muscle is your adductor longus. Similarly, there is a very short muscle, and this muscle also helps in adduction of the thigh, hence the name of this muscle is your adductor brevis. Brevis means short. So one muscle is your adductor longus, which is very long muscle, and the other one is your adductor brevis, which is your short muscle. And not only that, we have a very large or very big muscle which helps in adduction, and this muscle is called as your adductor magnus. Very large muscles which helps in adduction of the thigh, hence it is called as your adductor magnus. And not only that, we have two small muscles here. These are brothers and sisters. The name of the muscle is your pectineus muscle, and the other one is your gracilis muscle. Okay, so pectineus and gracilis muscles are also the adductors of your thigh. Now the main important thing here is that, can you see this adductor magnus muscle is penetrating the posterior compartment of the thigh, or this adductor magnus muscle is going to penetrate the posterior hamstring muscles, hence this muscle is called as your adductor magnus hamstring part. Now why this is important? Because this nerve, usually the muscles of the medial compartment are innervated by obturator nerve, but the only exception lies here is that the adductor magnus muscle, which is penetrating the posterior compartment of the thigh, is supplied by your tibial nerve. I hope you are clear with this. Now I am going to summarize the muscles of the anterior, medial and the posterior compartment. So in the anterior compartment we were having mainly two muscles. One was your donkey, which was your sartorius, and the second one was your rectangle shaped muscle called as your quadrangular muscle. And what is the nerve supply that is supplied in the anterior compartment? It is your femoral nerve, and this femoral nerve is derived from the posterior division of the lumbar plexus, usually L2, L3 and L4 branches. Okay, now we are going to talk about the medial muscles of the medial compartment of the thigh. The main muscles here were the adductor longus, adductor brevis, which was the short muscle, the brother and the sister, which is your pectineus and your gracilis muscle. And not only that, we have very huge muscle called as your adductor magnus. Okay, so all the medial compartment muscles are supplied by which nerve? Which is your obturator nerve, and obturator nerve is derived from the obturator nerve is usually comes from the anterior division of lumbar plexus, usually L2, L3 and L4. I hope you are clear with this. The only exception here is your adductor magnus hamstring part. So I am going to include in the posterior compartment, posterior muscles of thigh. So in the posterior muscles of the thigh, what were the main muscles? Adductor magnus, hamstring part, and not only that, we have semi-membranous, semi-tendinous muscle, and not only that, we have the biceps femoris. So all the muscles in the posterior compartment are supplied by your tibial nerve. Okay, the only exception here is your biceps femoris short head. Biceps femoris short head is supplied by your common peroneal nerve. So tibial nerve is derived from, it is derived from the anterior division of the lumbar plexus, usually L4 to S3, and finally the common peroneal nerve, which is your posterior division of the lumbar plexus, derived from your L4 to S2. Okay, so biceps femoris usually have, suppose this is the muscle of the biceps femoris, it usually have the long head and it usually have the short head. So the long head is supplied by the tibial nerve and the short head is supplied by your common peroneal. This one is very important here. The exceptions are really important. So the only exceptions were the biceps femoris muscle, and the second one was your hamstring part of the adductor magnus, which is usually supplied by your tibial nerve. I hope you are clear with this. I already talked about the muscles and its nerve supply completely here. So that was about it, guys. Thank you.